You. Okay. Thank you so much. Great to be here. And we are going to take a deep dive into the data, both into the existing data and also how we can dive in and get more data and use that actively. So let's dive right in. So this is an interesting slide from a paper just published recently showing the relationship between nutrient production and the size of farms globally. And what you can see there, in fact, is that Australia and New Zealand, most of the nutrients in that region are produced by large farms, farms greater than 200 hectares, in fact. Look over to China, and you can see that, in fact, the majority of these nutrients, zinc, B12, vitamin A, protein, etc., are, in fact, being produced by smaller farms. Now, if you look at this information a bit more carefully, what you end up observing is that these diverse landscapes, the smaller farms, are in fact the more diverse ones, and creating a greater variety of foods. And here you sort of see that. So this is a diversity index where the darker the color is, the more diverse the food production is in that location, and likewise is the food consumption. And what you see there is in US, North America, and South America, Australia, in fact, these regions with these very large farms, their diversity of production isn't very high. On the other hand, you see there in Western China, India, and parts of Sub-Saharan Africa, much more food diversity. And that's where these smaller farms tend to actually be. So what we learn from this, at this point actually, is that these small farms are producing more variety of foods. The large farms tend to be less diverse, producing more sugar and oil, maybe feed for farm animals and industrial at scale. And the nutritional context, the nutrients we're getting much more from the smaller farms. And the overall global intake of key micronutrients, 53 to 81%, in fact, is from these smaller farms. But these smaller farms tend to be a little bit less, maybe economically viable in some way. So the question becomes, how do we actually create a better food chain, allowing these smaller farms to be more successful? So I'm going to come to that, but first let's look at how that relates to the nutrition. So here's a graph, a global graph of stunting, the prevalence of stunting globally. And we've all heard over the yesterday and today, how nutritional deficiencies actually can affect stunting. And it's interesting that, in fact, a relatively small number of countries in the world, around 30 countries or so, account for 95% of the stunted children in the world. And Indonesia, you can see there, is amongst them. You see the Philippines there. India, I'm originally from India, so you can see a lot of folks from India stunted, and of course Sub-Saharan Africa. And so this is due in part to nutritional deficiencies and during pregnancy and also childhood. So just quickly, let's look at some results from Indonesia. In fact, what's the impact of these deficiencies? So this is just some data from here from Indonesia, a large-scale randomized trial that we had done years ago here, giving a complete nutritional supplement, micronutrient supplement, to women who were pregnant and looking at the outcome of that on the kids. And what you see here, in fact, is this large-scale trial, around 31,000 moms getting the multiple micronutrient. It reduced child death by 18%, 38% reduction in child death if the mothers were anemic. Again, showing that if the mom's anemic, there's multiple micronutrients that she needs. In fact, a 10-year follow-up of these kids showed that the kids' cognition was improved, and recently a large-scale analysis of micronutrient supplementation globally is showing that, in fact, a bigger 19% reduction in birth weight and bigger impact, in fact, on surviving girls than boys. So this is through supplementation, but what we really want to do is improve the food intake, the diversity of food intake. And so that's going to mean bringing together the agricultural production and the consumers, so we're able to actually create a improvement. So where do we go from here? Well, we have to ensure that the global food supply remains diverse. That's not enough. We actually have to link production and consumption and profits. right? Because if farmers can't be profitable for producing healthy foods, what's the point in doing that, right? They won't have incentive for that. The other thing we have to think about is how to integrate with other SDGs. And I want to bring up this idea of universal health care. So SDG 3 is a mandate for universal health care. Now, most universal health care has been about providing free service for treatment of disease, whether cardiovascular disease, chronic disease, care during pregnancy, sickness during childhood. And interestingly enough, a large proportion of total claims for universal health care has to do with the chronic diseases later in life. And those are influenced by actually poor nutrition during pregnancy and early childhood, and also poor nutrition and consumption during the lifetime of that individual. So this is something that countries have great incentive to, in fact, invest in healthy lifestyle, healthy eating, in order to make universal health care affordable. And this is something I think is critical for us to link into as far as we're thinking about sustainable food systems and healthy food systems. So this fourth bullet point there, this one idea of one size fits all, that we can somehow come up with some policy or solution that's going to work everywhere, is probably not a viable idea. And we need to find some way of looking at these diverse farms, small farms, large farms, the diverse needs of people, pregnant women, kids, elderly, how we can bring this together in an adaptive solution, creating a sustainable and healthy food supply. So here's one idea, another deep dive into the data idea. This is a platform that we created called Open Smart Register Platform. And the idea behind Open SRP is to, in fact, take the data that frontline health workers and agricultural workers collect every day, and make that data come alive through putting it onto electronic platform and being able to really use this to assess changes and make recommendations actively. So it's open source and scalable, community workers data comes alive, decision support, interactive chatbots using artificial intelligence to produce information, to feed back to clients at the community, and also for the health workers. And workers can share data. Multiple frontline agricultural workers and frontline health workers can actually share data so they know which foods, healthy foods, are available where, that you can recommend actually to pregnant women or kids or anyone to consume. So this is just to highlight that this kind of solution, this kind of platform, in fact, can be created anywhere. In our case, we actually engaged coders and developers in Indonesia, Bangladesh, Pakistan, and Kenya. And in fact, they successfully created this Open SRP platform with several countries using this now, global deployment. So let's come to some examples, some practical example. So here is just to sort of walk you through. Let's start at the top there, in fact, where you might have a community agricultural extension staff consulting with a farmer and discussing what kind of crops you could grow that would be more nutritious, and there might be a market for it, there might be a demand for those. And then, of course, that farmer plants that, smart information is entered into this data system where you have some advanced analytics. A chatbot might consult with the farmer and say, well, look, here's how you can optimize the growth of those crops, when to harvest them, based on when there's a market demand for that, when the price actually might be high, and when they can make a sustainable profit from that. On the bottom side, you could have an example of health. Let's say a woman is undernourished in some way, pregnant woman, she's detected by a community health worker, that information goes into OpenSRP, and then based on what she says she likes to eat and what she can afford and what is produced locally, those foods can then be routed to her and made available for her. So this creates a sustainable solution for her to be healthy and linking the agricultural sectors and the health sector, leading to greater dietary diversity for her and her family, and leading to a healthier lifestyle. So all of this can also be linked directly to policies, incentives from the national health insurance, from agricultural incentives, to link this together into a dynamic system leading to sustainable healthy agriculture and sustainable positive health outcomes. So where does this bring us? To some really key, interesting action items. So Number one, we need to pursue a dynamic and resilient data-driven approach. It's not a one-size-fits-all. We need to transform existing frontline agriculture and health staff into a network of groups of people working together, incentivized through universal health care or other key government programs that might be used to make this healthy and profitable. And I would say a major call out to start today, in fact, at local district level. Let's do something innovative, let's fail fast, and then figure out how to succeed at scale. We all know what the problem is. We have some idea what the solutions are. Let's start trying those and see where we can get. That's the whole idea of using data in an interactive, iterative process quickly to find out what's the direction we need to go in. So I'll end with this quote from Helen Keller, alone we can do so little, together we can do so much. Thank you so much.